Welcome to Dr. Anis Fatima's Fetal Medicine channel. Let's look at 3 abnormal cases of visceral situs today. The first picture is of the normal visceral situs. The stomach is on the left, the aorta is slightly to the left of the spine, and the inferior vena cava is anterior and to the right of the spine. In picture 2, note that the heart is pointing normally towards the stomach. It is considered a good practice point to save the dual image of the thorax and visceral situs. Case 1, abnormal visceral situs, can be seen in picture 3. The abnormal visceral situs with the aorta and the inferior vena cava are both to the right of the spine. In this case, we can presume that the heart could be in the right hemithorax, so you can start looking for it there. And it is confirmed. It is the same case as the previous one, and the heart is completely in the right hemithorax, almost touching the ribs, as that can be seen in picture 4. This was a case of complete agenesis of right lung. The second case of abnormal visceral situs can be seen in picture 5, is that there are 2 vessels side by side near the spine, and the normal inferior vena cava cannot be seen. This is a case of interrupted inferior vena cava with an azygous continuation. For confirmation, we should examine the sagittal section. In this picture, we can observe 2 parallel vessels side by side in the abdomen. Picture 7 is also a scan from the same case. The cross-section of 2 vessels instead of a single vessel, that is the aorta, is seen between the left atrium and the spine. The third case of abnormal visceral situs is seen in picture 8. This is a case of complete situs inversus, where the stomach is in the right hypochondrium. At just 1 month old, the baby underwent surgery for volvulus malrotation of gut and is doing well after the surgery.